right, this is our PowerPoint video recording covering the Cardiovascular Assessment Lab, which starts on page 71 of your lab notebook. Before we begin, I want to just talk about the upcoming lab exam next week, covering 3 topics: nutrition, which is on page 51, digestion on page 43, and cardiovascular assessment on page 71, which we'll talk about today. There's a lot of information in the nutrition lab, so therefore what we've done is the instructors have gotten together and we've outlined these major topics that you should review for the nutrition part of next week's lab exam. There will be 6 questions on the lab exam from the nutrition pages, so I would focus on these major areas so you can direct your attention a little better to the other 2 labs and not spend too much time getting bogged down in the details of the information in the nutrition lab. So focus on these major categories. And again, there'll be 6 questions total coming from the nutrition portion of our next lab exam. So today we're going to talk about the cardiovascular assessment, which is on page 71 of your lab packet. And I've created some PowerPoint slides here that go over each of the objectives shown on page 71. So we'll start with looking at peripheral pulses versus apical pulses. First of all, when we look at the heart itself, the pointed region of the heart lies slightly to the left of the midline in the chest, and we call that pointed portion of the heart the apex. So the apex actually beats against the chest wall when a person lies on their left side, and you can feel that heartbeat against the chest wall if you lay your hand right around the 5th intercostal space just below the nipple. So you can feel that. And some thin people can feel that if they're lying on their left side in bed, for example, they can feel that apex beating up against the chest wall. So when we want to get an accurate heart rate, for example, if you're giving a cardiac med to an elderly patient, we don't want to rely on a pulse out at the wrist, which we call the radial pulse, because that might not be the true pulse. Oftentimes elderly individuals might have a hardening of the vessels and poor perfusion of the vessels, and we're not going to hear every pulse of blood that it leaves the heart because those vessels just can't transmit that pressure wave efficiently. So therefore we always want to take an apical pulse. So right here shows you the correct location on the chest for obtaining an apical pulse. So again, it's just at the apex of the heart, and it's the most accurate location for getting a true heart rate from your patient. And again, between 60 to 100 beats per minute is typical for adults. Obviously it would be higher in children. It can be lower in trained athletes, and it can be lower in those with a failing heart. So we have to really know our patient and what factors are leading into their heart rate. So other places we can obtain a heart rate are what we call the peripheral pulses. So they're based on arteries outside of the heart. So here we see the brachial artery in the upper arm. That's where we put the blood pressure cuff to measure pressure. So that's the closest to the heart. So it's a good location for measuring blood pressure, and we can also get a heart rate off of that reading if we choose to. So that's in the arm, in the upper arm, the brachial artery. And then the radial artery is down on the thumb side of the wrist. That's a common location for checking heart rate for yourself. If you're exercising or want to check your resting heart rate, the radial pulse is a good location, as long as you have good vasculature and you don't have hardening of the arteries. Another good choice that we use is the carotid artery up in the neck. It's just to the left or right of the voice box of the larynx, and that's a good location for a patient maybe that's fallen and you need to perform CPR and you need to determine if they have a heart rate. So you need to know if you need to do chest compressions or call for an AED. You're going to feel for that heart rate, again, just to the left of the larynx in the neck. And then there's the temporal artery up on the side of the head. That's not something typically we're going to use to measure heart rate, but in very premature infants, sometimes that is used. Most commonly, brachial, radial, femoral pulses. Again, in infants, that's another common one that's used. Popliteal, posterior tibial, and dorsalis pedis pulses. These are pulses that we routinely check in patients maybe that had surgery, maybe a hip replacement or a knee replacement, and want to make sure they're getting good blood flow through the vessels and they don't have a blood clot as a result of surgery. So the popliteal artery and popliteal pulse is behind the knee. The tibial pulse is just on the inside of the ankle. Excuse me. And the dorsalis pedis pulse is on the top of the foot. So those are some peripheral pulses that can be used on patients that maybe don't have a good reading from the brachial pulse. For example, extremely obese patients oftentimes have a lot of fat over the upper arm, so we will commonly use the lower arm for the blood pressure cuff or the lower leg for that blood pressure cuff because they tend to not have as much adipose tissue over those areas. So in lab, we want to take a blood pressure so you're comfortable with the process and you can learn what your blood pressure is. So when we come to lab next week, I recommend that you check your blood pressure. We'll have a little time in lab for anybody who wants to do that if you don't know your current blood pressure. So when we look at blood pressure, the definition is the measurement of force applied over the walls of an artery with each heartbeat. So we would expect the pressure to be the highest when the heart is at the peak of contraction, and then the pressure inside these arteries should be the lowest when the heart is relaxed. So when the blood is flowing through a slightly collapsed artery, it produces these sounds called corticough sounds, which is turbulent blood flow coming through an artery that's being constricted by a pumped up blood pressure cuff. So when we hear a tapping sound first appear in the stethoscope as we're listening over the brachial artery, we call that the systolic blood pressure, and that's when the heart is contracting at its peak. That's when that force of blood will be able to make it through that constricted vessel as we're puffing up the cuff. And then the diastolic blood pressure is when that tapping sound disappears. So when it first appears, a clear audible tapping sound first appears, then we call that the systolic blood pressure, and the pressure when that disappears, that sound disappears, we call the diastolic pressure. So here's a video clip that is an overview of collecting a blood pressure. And then in the next slide, we'll actually go to an animation where we collect the blood pressure, and you can listen for the tapping sounds that are heard through the stethoscope. Auscultation means listening through a stethoscope. So that is a method for checking a blood pressure by listening through the stethoscope. So we'll continue on here. There's a nice interactive tutorial here where we'll actually hear the tapping sound, so you know what this sounds like when you're trying to collect that first systolic pressure. To do that, you need to download this brief download called Cosmocyte. Doesn't take long to do, so I wouldn't be too concerned about that. So we're going to click on the blood pressure cuff, place it on the arm, and we're going to inflate the cuff to 180 millimeters of mercury, watching the gauge here. I'm just going to press on it. All right, and then we're going to apply the stethoscope to the brachial artery, and then I'm going to turn the valve by moving it upward, because we turn the valve to the left to deflate the cuff. So I'm going to slowly turn it up, and when I hear that visible tapping sound, I'm going to hit enter on my keyboard. And then when it disappears, I'm going to hit enter again. That would be the diastolic pressure. So listen carefully for these sounds. I can hear that tapping sound. And then it disappeared. And now I'm going to hit my space bar to see the results. 70/50 was what I recorded, and the actual blood pressure was 78/43. Unfortunately, I did not have my speakers turned up high enough to hear that, so it was a little bit difficult. But I want you to try this on your own so you really get a feel for that. It's important that you do it on your own to get an understanding of how to listen to those sounds. So you can go ahead and do that. I'm just demonstrating how to use the animation. Okay, so moving on then. Well, if we look at the vessels, for measuring pressure, we always want to measure a blood pressure using an artery, because of the blood flow through arteries correlates to the pressure of blood leaving the heart. So if we look at the wall of an artery, we find that the three layers that make up the vessel walls, the muscular layer is much thicker in an artery compared to a vein. So in looking at this slide that's unlabeled, we can see this very thick middle muscular layer, which is called the tunica media. This is made of smooth muscle. It's much thicker in an artery compared to a vein. If we look at the other two layers, the tunica adventitia, that's the outer layer outside the muscular layer, it's shown in blue here, tunica adventitia, that's just the connective tissue around the vessels. We can see those are relatively the same in the arteries and the veins. This is again the outer layer, tunica adventitia. So you have tunica adventitia, tunica media, and then the inner lining, very thin layer, is the tunica intima. So that's this very inner lining of both arteries and veins, and it's very delicate, and that's what can become damaged for people that have high cholesterol diets or high cholesterol because of some other disease, resulting in blood clots eventually forming if that those fatty deposits continue to cause inflammation and platelet aggregation. So this is the tunica intima, it's the inner lining of our vessels. Another way to distinguish arteries and veins outside of just looking at the thickness of the muscular wall is to look at the size of the lumen. We'll see veins have a much larger lumen compared to arteries. It's because veins carry a lot of blood as it returns to the heart. They're called the capacitance vessels. They have a high capacity for holding blood. So look for that in the vein compared to the artery. And there's also a picture of this that is labeled with the three layers of the arteries and veins in the study room in the big blue binder. So looking at blood pressure values, you should know these numbers. Low blood pressure would be anything that is 50 to 90 and 35 to 60 for diastolic, because a normal pressure is 120/80. So if we have a pressure, a systolic pressure that is 90 or lower, that's considered low blood pressure. And high normal, which we call pre-hypertension, is 120 to 139 and 80 to 89. So oftentimes people have these higher values and they think that, well, it's close enough to 120 over 80, I'm okay. But the reality is they have this pre-hypertension, which is going to do damage to the heart if it's left untreated. So it's really important that people know what their blood pressure is and check it regularly, even if they're on a blood pressure medication, because oftentimes those blood pressure medications need to be adjusted over time. And then high blood pressure begins at 140 over 90. So be sure to know those values, the normal, the pre, and the high blood pressure, where it begins. So a measurement that you can get to determine how well you can deliver oxygen to your tissues during exercise is called the VO2 max. And these are the normal values for males and females. And if we really wanted to get an accurate measurement, we would get on a treadmill where they measure your heart rate and the carbon dioxide and oxygen levels in your exhale to determine your cardiovascular fitness. But what we're going to do is we're going to use a worksheet in class, and you're going to do a 1-mile walk test and gather some data from that. And that's described here in part 3 of your lab worksheet. And then enter that information into the formula to figure out what your individual VO2 max is. So I highly recommend that you do that so you understand where your cardiovascular fitness is, because as a sedentary society, oftentimes we find that we are below average in our cardiovascular fitness, and it's something we can very easily improve, and we'll talk about that here in a few minutes. So I have a video here showing someone getting a VO2 max done in a clinical setting. It's quite intense. It's not for everybody. They usually want to determine this in elite athletes to see if they can improve their cardiovascular fitness. So this is just an example of what that looks like. So they have to go at max intensity while they measure, again, the exhaled gases. So I'm not going to show the whole thing. That's just a little video clip for informational purposes so you can see what that looks like. So looking at an exercise program, if you're going to try to improve your aerobic capacity, you want to look at 4 factors. So you should know these 4 factors for the lab exam. Frequency, how often you're exercising. We recommend 3 to 5 times a week. Intensity, you want to make sure you're bringing your heart rate up to 50 to 85% of your heart rate reserve. And we'll talk about how you calculate that. And then also how long you exercise. It's important that your heart rate be in the heart rate reserve for 20 to 60 minutes. And then consider the mode or type of exercise. So is it an exercise that is good for your joints? Is it something that you enjoy doing? You don't want to pick an exercise that is damaging to the joints and that you don't enjoy, because you're less likely to stick to an exercise program like that. The elliptical machine is an excellent machine that is relatively new. It wasn't real popular 30 years ago, but excellent machine for reducing your feelings of exertion as well as your impact on your joints. So to figure out some information to get started, figuring out what your heart rate training zone should be, you need to calculate your resting heart rate and then figure out what your maximum heart rate would be. So you just take the number 220, subtract your age from that. That's your maximum heart rate based on age. And that can differ for individuals. If you happen to be a little more in shape throughout your life, you might have a higher maximum heart rate than someone your age. Your heart rate reserve then is subtracting the maximum heart rate from the resting heart rate, and then you take 50% of that value and 85% of that value, and that's your heart rate range where you want to be during exercise. So the higher you are during exercise to that range, the greater the cardiovascular improvement you'll see. But if you're starting out an exercise program, you want to stay in the 50% of your heart rate reserve. And in your lab packet, there's also an example of how to calculate those numbers using a person who's 20 years old and a resting heart rate of 68. So that's on the top of page 76 if you want to see an example of how to find that target training zone, because you may be asked to do that for the lab exam. So another useful factor for seeing how well you're doing in your exercise program is to look at the perceived exertion scale. And it's just something how you feel as you're exercising, how difficult is your exercise during that 20 to 60 minutes. To be in the target training zone, typically we find that the intensity is rated by the individual as being hard or somewhat hard. So if a person is walking on a treadmill and they're barely out of breath and they're talking and laughing and they're on that treadmill for an hour, that's really not going to improve cardiovascular fitness. It may burn fat calories, which is helpful, but if you really want to strengthen the heart, you need to get into that higher zone of feeling it's hard or somewhat hard. So that concludes our lab on the cardiovascular assessment. Again, if you want to look at that nutrition, those nutrition pages, be sure that you focus specifically on what I mentioned in the first slide.